Well, of course, we know the holiday season can be the happiest time of the year, but what most people don't know is that this can also be an increased time of the year for stroke. Dr. Tamer Abdelhak, Chief of Neurology at Spectrum Health Medical Group, is here, Dr. A, to join us to tell us exactly why this is the case. Why is this an increased time of the year for a risk for stroke?
Good morning, Terry, and happy holidays to all of Grand Rapids and all of Michigan. Definitely this time is an exciting time. Everybody is out regardless of the beautiful weather we're having.
Exactly.
And the snow on the road. People are out shopping. They are out for hours. They are not eating their regular meals. Some of them forget to take their medications. Those of them who smoke, it's a cold weather, so they're smoking a little bit more. And with all added stress of shopping, parties, invitations, all of these things, your blood pressure goes higher and higher. And if you have high cholesterol, all of these things, there is definitely an increased risk of having strokes and heart attacks during that time of the year.
What exactly is a stroke?
A stroke means that part of the brain is dying because there is no enough blood reaching to the brain, because there is a blood clot stopping the blood from flowing there. In a small percentage of people, it could also be a brain vessel that just broke under pressure, and you can have bleeding in the brain, maybe because there is a brain aneurysm or something like that.
So would you have symptoms of this that somebody could recognize?
Absolutely. And what we try to tell our families and our communities is that you don't need to be a medical professional to recognize symptoms of a stroke. We use something called the FAST scale, and basically if somebody has like a facial drooping, you notice that their face is twisted to one side, they're feeling arm weakness or numbness, or leg weakness or numbness, their speech is a little slurred, it's time to call 911. So because time is of an essence. Every minute blood is not flowing to the brain, you're losing 2 million brain cells.
Wow. And so is there an age group, or maybe you're more likely, or maybe a personal profile where you're more likely to be at risk for having a stroke? That sounds terrifying.
Absolutely. It's the same thing like a heart attack. So obesity, smoking, high blood pressure, diabetes, high cholesterol, all of these are risk factors for stroke. We see it mostly in the elderly population, age above 50s. But what's shocking in the past few years that now we're seeing people having strokes even in their 20s and 30s, and could be because of increased smoking in this age group, could be stress, sometimes use of drugs, unhealthy life habits.
Obesity.
Obesity is a big deal, but I was just talking to my colleagues. West Michigan seems people are more concerned about their fitness and their lifestyle than eastern part of Michigan, but we still see a significant portion of that.
Okay, so what about heredity, family history, that sort of thing?
Very small. Some people, even though they are fit, they have family history of high cholesterol, and they need to take medication even though when they are in 20s and 30s. Some people have hereditary reason to have brain aneurysm, which could put them at a potential of bleeding in the brain, and we see that even sometimes below the age of 20, but we see it 20, 30, 40, and they can be quite devastating. So definitely if you have a family history of strokes in your parents and your family, that means you might be carrying genes for certain risk factors that can lead to strokes.
Okay, so why don't you tell me what happens if somebody gets to the emergency room, gets medical treatment quickly? Can you reverse what's going on? Can you stop the symptoms?
Absolutely. We are now living in a world of medicine that's geared towards reversing and curing stroke. So people don't have to live anymore with disability and paralysis. Now, if people come within the first 6 hours of stroke, and the earlier
6 hours?
6 hours. In the past, we used to say 3 hours. Then it became 4.5 hours. Now it's 6 hours. We have the tools, not just medication that we can give patients to clot bust any clots that are stopping the blood flow, but we also can use catheter. Same like when you have a heart attack, you go to the cath lab, we put a catheter through your groin and go to the heart and suck the clot. We can go with the same catheter to the brain and suck the clot out and completely reverse the symptoms of stroke. So we can help 1 out of 4 stroke victims if they come early. The earlier, the better.
Okay, do they have to come to a specialized medical center, or could any emergency room? What if you're visiting and you're in a rural area, only access to a smaller hospital?
Well, the key is to get to where a medical professional can assess. Definitely not all hospitals have these 24/7 capabilities of dealing with strokes. But let's say you're 2 hours away. We don't want you to waste 2 hours to try to get to a highly specialized. You go to the nearest emergency room. And the only way you can do that, call 911 because they have a mapping. And now what we have now is a stroke network through the whole western part of Michigan. Even if you go to a smaller emergency room, they have the connectivity with us through telemedicine, phones, and we can exchange images. And we're deploying robotic systems soon, so we can see these patients right away, no matter how far they are, can start the treatment in a remote location, and then if they require the specialized catheter to suck the clots out or fix their brain aneurysm, we can fly them over and we can take care of that in highly specialized centers in Grand Rapids.
You're right, this is a remarkable time of the year to be alive. So if people are interested in getting more information, I know Spectrum Health does a great job. Education is really the cornerstone.
Absolutely. We try to go out to the public and community and educate them. There are lots of information available on our website of Spectrum Neuroscience, but also through our phone number they can call, and if they're worried, I'm sure our primary care physicians, they all have connectivity to give the patient these best information.
Well, that's great. And again, the neurology group at Spectrum Health Medical Group, one of the best in the country. Thank you so much.
Thanks, you so much,
Dr. A.
Terry.
Great information. And again, if you think somebody you love is having symptoms of a stroke, you have to ask fast.
Don't hesitate, act fast, call 911.
Fantastic. And stay right there. More of 8 West when we come back. Don't go away.
This is 8 West.